Welcome to the Transformation Institute's podcast for change. Here is our host, Omari Jahi Aton.
Hey, what's happening, y'all? Welcome to the Transformation Institute podcast for change. I'm your host, Omari Jahi. Thank you for being on this podcast. As you can tell, we've switched everything from Facebook and it's totally on YouTube now. The whole podcast, you can only be seen on YouTube. All right, so make sure y'all share that message with everyone. Subscribe to our channel. Make sure you like our podcast, because when you do that, it goes out to more and more people. So we thank you for that. And with that being said, oh, wait a minute. Let me put my information. Okay. With that being said, our show tonight, or this episode, is going to be based on Chicago's #1 doctor that we had on before, but we didn't get a chance to ask a lot of the questions that we wanted to ask because we ran out of time. So she was so gracious. I say graceful, Lord have mercy. She was so gracious to come back again so that we can kind of ask a little more questions and get a little bit more information on the health tip. So with that being said, let me introduce to you my co-host and our guest for this evening, Dr. Sonia Oyola. I always mess up her name. Oyola. There it is. Dr. Sonia Oyola. Put your hands together for her as we bring our co-host and Dr. Oyola to the platform. All right.
Thank you so much. Thank you for having me back. Omari, really, what a pleasure. I had such a wonderful time with y'all the last time we were together, and we had a wonderful conversation. So I'm looking forward to part 2. So lovely. Thank you very much.
And so we only got an hour, so we're going to jump right in right now. And I just want to let everybody that's on this, I know people are still getting on, but we're only going to deal with questions today. If you have questions for the doctor, put your questions in the comment. But if you got comments, if you agree, we're not putting your comments on the screen. But if you have a question, we're going to select your question and put it up for the doctor to answer your question. Okay, so again, and don't write books. Please don't write any books, because we're not putting books up. You know, kind of make your questions short. All right? All right, so let's get started. All right, I'll go first. So my question is basically, I want to talk about foods. Well, maybe I shouldn't talk about foods, but it's basically all of these illnesses that we have: high blood pressure, diabetes, low sugar. Y'all know where I'm going with this, right? All of these things, a lot of times we say, I know when I go to the doctor, they ask me, well, was your mother a diabetic, or was anybody else in your family a diabetic? You know, and you're like, yeah. And so we begin to think that it's a hereditary kind of thing. You know, if your father were diabetic, or if your mother and father had high blood pressure, it's a likely conclusion that you'll have high blood pressure as well. So that's my question is this really a hereditary thing, or is it dealing with the foods we eat, and is it kitchenary, meaning that it's something because of how our parents or our mother cooked? You know, sometimes we cook with a lot of sugar, a lot of salt, and that's the reason why generation after generation we pick up these recipes from our parents, and we're not only picking up the recipes, we're picking up these ailments as well.
That's such a wonderful question, Omari, and I think you're so right. I think a lot of patients that I have met over the years, I have asked them, of course, what their family history is. You know, what is running in the family. You know, what do they recall their mother had, or their father, or their grandparents, their ancestors, and I would say that chronic illness like diabetes, hypertension, cancers, there is a genetic predisposition to developing those later as adults. But what I would say is what we used to learn in medical school is that our genes were fixed. In other words, if you have a family history, it was almost determined that you would develop these diseases. It was almost a given that you would develop these diseases. We know differently now that our genes are actually not fixed. Our genes are very flexible, and our genes can turn on or off according to the external stressors that we experience. For example, an external stressor like not having healthy food, not having clean air to breathe, experiencing poverty, experiencing trauma. In fact, those stressors can activate our genes. And so we have this predisposition, but actually what our external stimulus, if it's stressful, can make those genes turn on. One example I can give you is there's an important study called the Adverse Child Experiences Study, where we see that the more adverse child experiences you have, the more likely you will develop conditions like diabetes or hypertension as adults. So that's a classic example of what I'm talking about here. Now, if you just the opposite, so we're just talking about stressors, but if you have just the opposite stimulation, you grow up in safety. You have access to foods that lower the blood pressure. We were just talking about teas, for example, that will lower our blood pressure. Foods that can lower our blood pressure. If you have access to being able to exercise, being able to live in a calmer fashion, and however that means nowadays, then those genes may not get triggered. They may not get turned on. So, and in fact, if we start living with those factors, stress reducing factors, healthier foods, the genes that we're on may actually also be able to turn back off, which is amazing. And that's something that to me was one of the most hopeful things that I ever learned in the more recent years when I started learning more about integrative medicine. So yeah, I love your question. There is a genetic predisposition that's passed on from generation to generation, but how those genes turn on or off very much depends on our lifestyle.
Oh, wow. Okay. So it is kitchenary in a sense.
That's right. It's genetic and it's kitchenary. It's really both things. It's a combination of both things. And for each individual, those factors may be stronger than another. Mm-hmm. Okay. So we can't say that let's say for myself, it's equal. The equal amount of the genetic predisposition I have, the amount of stress reducing factors are going to be the same as, for example, a Brenda might need, mm-hmm. right, to prevent that blood pressure or hypertension or diabetes, right? So that's also what's really incredibly special about humans, about us, is that we are very specialized and we are very unique in the kinds of things that we would need to prevent those diseases. It isn't a blanket one size fits all, which we're learning more and more about now with something called precision medicine, where we can actually test the genes and know for this person, these are the particular kinds of foods that they would need to prevent disease. These are the particular kinds of foods that actually worsen their condition. And that's very exciting. And that's the newest research now that I hope is still continuing at the National Institutes of Health.
Now, is there a certain doctor, is that a nutritionist that you would see to get that kind of information?
That's a wonderful question. It would actually be a geneticist. It would be a genetic counselor eventually. When we're talking about precision medicine, there are more and more doctors being trained in this approach, in these ideas, and thinking, okay, what is your specific risk? Let me refer you to a genetic counselor so you can get that conversation started and also get the right testing for you. And so that's a medicine that is growing and growing now, more than ever.
Great, thank you. You guys got anything for the doctor?
Yes, I want to say this. You said just now, I hope that this is still being tested or something. You said the precision thing. Okay. A lot of people kind of think that that doctoring and a lot of I don't know the right words to say. I'm going to say doctoring. You know what I'm talking about.
I know what you mean, Brenda.
That going to that a lot of doctors are doing things like you have a lot of doctors that have you in real quick. They hardly listen to you. They do something real quick and they get you out. It's like they're on the schedule. My mom was in the hospital a while ago, and I have a problem with Rush Hospital growing as big as it is. So I'm saying that to say, you said, I hope that they are still studying this, because there are a lot of people who talk about that the medical field they can't cure a lot of things. They can't find a cure for cancer. That will take away a lot of money from the medical field. And I mean, that's kind of a controversial subject, but I'm one of those that went to the hospital and saw Rush was just so big, and my mom's room was like a hotel room, and it was like I'm just saying that it triggered me when you said I hope that they are still testing it. Why would they not be?
Great question. The decisions to study different types of diseases or conditions, the decisions to study that in many ways are influenced by policy, and policy in our government decides, the committees there decide on the budget, the budget for the year for studying different kinds of conditions. And so when I say hope, what I'm referring to is that if that budgetary committee for looking at precision medicine is still very invested and values that research or values that topic, then that the research will continue. And so that's what I'm hoping for.
Okay.
Wow.
Yes.
And that's amazing, how you have a committee of people. Now, are the people on these committee doctors? Are these?
Wonderful question. That's a wonderful question. Well, when I was a fellow for the NHMA, which is the National Hispanic Medical Association. That was last year. I was a fellow for that association, and I had the privilege and the honor of going to Washington, D.C. and sitting with different House representatives and senators and House rep assistants to really explore that question, to bring forth also policy around healthcare workforce and diversifying the workforce, because we have a very diverse world and community. And so the more diverse the workforce is, the more likely all people will be attended to in the highest quality of care. And so I had the privilege of visiting with those folks. Some of their would allow for appointments for us to visit with them to share what, as we physicians here in Chicago and physicians coming from minoritized populations, the Black community, the Latinx community, and many in the Asian communities, minoritized communities that really are immigrating here and not really able to access healthcare. What amplifying the voices of those individuals and those communities. That was our charge. That's what we were there to do. For myself, particularly the Latinx community. And I was actually surprised, Omari, that more often than not, these committees did not have physicians on the committees. And so I realized how incredibly important it was for me to be there, and for us to be there, really representing the voices of the peoples that we're working with and our patients, right? Our patients. And so I was struck by that, and also realized very quickly then how important it was for patients and for physicians and for any healthcare provider to be present as possible in those spaces, in those offices, and talking with those individuals, because if that's not the case, then they will create policy that's completely disconnected from what patients need, right? Yes. And what communities need. So thank you for bringing up that question. I was surprised that more often than not, there were not physicians on those committees.
Yeah, that makes a lot of sense.
Yeah, it
actually makes a lot of sense given the policies we have. Yeah,
right. Exactly.
Right.
Hey, if you want to ask the doctor a question, again, put your question into the comment section, and we'll bring it up on the screen and ask the doctor. But until then, I think Kim, you had a question for Dr.
Yes, I did.
Mm-hmm.
I would like to know, when you're on high blood pressure or any medications, what are some good teas to drink? Because I know caffeine is a big trigger for high blood pressure. So if you can give us some type of teas to drink to help mitigate that, or something that's good to help while you're on those type of medications.
I love that question. Thank you so much, Kim. I love it. I would say, surprisingly, green tea, which has caffeine, is actually one of the teas that can be very, very helpful for our high blood pressure, mainly because green tea, that plant has wonderful set of ingredients in that plant that actually also help to lower blood pressure and also help with cardiovascular health, just circulatory health, the health of your blood vessels, the health of how your blood flows through your body. Green tea has been found to be really very helpful, and it doesn't have as much caffeine as coffee. So it has a much lower amount of caffeine, but you're absolutely right too, that if you're drinking a lot of coffee and that is exposing you to, and you're intaking lots of caffeine, you can get jittery, you can get anxious, you can get tense, you can get a headache from too much caffeine. And so that certainly can raise your blood pressure. So anything that you take too much of can certainly cause an adverse effect. And caffeine is one of them. But the caffeine in green tea, no, because it just doesn't have as much. The other herbs that can be really helpful for high blood pressure is hibiscus. Actually, and someone here on the call has already taken some hibiscus here, which is wonderful. And hawthorn is another tea. Hawthorn, very effective and helpful for varicose veins and poor vein circulation of the legs. Like if you're getting a lot of swelling of your legs from your veins being too full of blood, and you know that because you start seeing the veins on the surface of your skin. Those are called varicose veins. When folks have that, they can have something called venous insufficiency. In other words, the veins have little valves, and as the blood is flowing, those valves are supposed to close to keep it flowing in one direction, but sometimes the valves open, and then the blood starts going up in the opposite direction that it should. And so the blood starts to accumulate there in the leg, and that's how your legs get puffy and swollen. And in fact, that's how the skin starts to get dark, sometimes cracked, because of that swelling, that's happening. So hawthorn is also a wonderful tea that helps with circulation and helps with blood pressure. Chamomile is another tea that's great for high blood pressure because chamomile is a very relaxing tea, wonderful for anxiety. It's wonderful for tense mood. when you're feeling really tense. Chamomile, lemon balm, these are very relaxing, what's called adaptogens or relaxing herbs. So, and when your muscles are relaxed, what happens? You're in a deep sense of rest. Your blood pressure starts to go down. And the teas to avoid, which is the opposite, the question, but I think important to share is licorice. So licorice tea, if you're taking licorice, that can raise your blood pressure and pretty significantly. The other is ginseng. Ginseng can raise your blood pressure too because it's very energizing, very activating. So ginseng is good for low energy, fatigue, feeling sluggish. Take some ginseng, also been studied in memory, but if you take it and it energizes you, your blood pressure can go up. The other is St. John's wort. St. John's wort is another herbal that would be important to avoid to prevent, to make sure you're not taking, because it can raise the blood pressure, and mainly because St. John's wort interacts with so many different medications. It interacts with about just every medication that you could think of. So you have to be pretty careful about taking St. John's wort, but it's incredibly effective for depression. So for some mood disorders. So if sometimes when people don't respond well to conventional medications for depression, I'll think about St. John's wort for them. But if they have high blood pressure, I would avoid it. Yeah. So those are the ones to take and the ones to avoid.
Thank you. Good to know.
Yeah, you're welcome. Of course. My pleasure. Great question. Thank you so much. I learned a lot just you asking the question.
We have a question. My wife is on YouTube. So Yolanda, this is my wife.
Hi, Yolanda. How are you?
She's asking, what types of alternative sugars is good?
Wonderful, wonderful question. I often think that sweetening our food with our fruits actually is a really wonderful way to just get that extra sweetener, and versus table sugar or even brown sugar. Anything that is already in a fruit format, you have to process. So if you have to process it, you have to use energy. And as you're using your energy to break down that fruit to get to that sugar, at the end of the day, it's going to be less sugar in your body because you've used up some energy to get to the sugar. But if you're taking sugar directly in a table, like white tablespoon of sugar, your body doesn't have to break that down, and so it's not using any energy to get to the sugar. It's just pure sugar. And that's when your sugar goes up too high and too quickly right away. And if it shoots up, it goes right down very quickly. You get hungry right away. And your insulin spikes too when your sugar spikes. And when your insulin spikes over and over and over again, your body starts to become resistant to the insulin. And that's how you end up with diabetes. So any way that you can access sugar where it's in its most natural form, that you have to actually, your body has to break it down to get to the sugar, that's how I would sweeten my food, versus table sugar.
So I guess those sweet and lows and all of that other stuff, those
Great question. Yeah, great question. I think you could use those, but the studies have shown that actually it does just the opposite effect than you would think, because it increases your craving for sugar if you're using sweeteners. And so what you don't want is to crave it more. You don't want to crave sugar more, right? Because if you're craving it more, you want to take it in more. So those sweeteners or artificial sweeteners, while we think, okay, if I take it, it's not going to actually increase my amount of sugar because there's actually no actual sugar in it, it still increases the craving that you have to eat the sugar. So at the end of the day, while we're thinking, okay, this is better than not having any sugar at all, you still end up craving it and you still end up consuming it because of the cravings. So so we have to just be a little careful. Among all the sweeteners, I would say stevia is the one that I think is probably the healthiest among the artificial sweeteners, because stevia also has been shown to be very helpful for patients with diabetes. It comes from a natural plant called stevia, and it's really probably among all the artificial sweeteners, the one that I would pick if I had to pick one. But if you, at the end of the day, if you want to just try to reduce your cravings, artificial sweeteners are not going to reduce cravings. They're going to just increase them. Mm-hmm.
Okay.
I have one quick question regarding that before you go on to the next question. What about raw honey? Is that good? Organic raw honey?
Well, raw honey, so special because it doesn't just have sugar. Honey also has a lot of really interesting properties, just like green tea. It's got a lot of. When you think about how it's made, and you think about the relationship that bees have with nature and how bees have to stay healthy in order to survive in nature. The properties that bees need to stay really healthy actually is in the honey too. So honey has really wonderful properties to help with the immune system and immune health. Now, if you're taking and consuming a ton of honey, your sugar is going to go up. Your blood sugar it's like 230, and so it's all in moderation. But certainly, if you had to pick between table sugar and honey, I would lean toward honey just because it has those extra antibacterial, antiviral, immune enhancing properties in honey that your table sugar just does not have. Yeah.
Thanks.
Yeah, of course. But everything in moderation, of course, Mm-hmm.
Dr.
Go ahead,
Vanessa.
Vanessa. Go ahead, Vanessa.
Something about plant-based. What about agave?
Agave that's such a great question. I would say compared to honey, agaves, I think glycemic index is about the same, but let me look that up for you because I haven't really thought about agave in a while, but let me look up what's the glycemic index. What that is how high does the sugar go up when you have the same amount of it. Like if you have a tablespoon of sugar, you have a tablespoon of honey, you have a tablespoon of agave, how high does it go up? How quickly does it go up? That's called the glycemic index. And anything that's in like the 20 to 40 range is it doesn't go up that quickly. Anything that's in like the 50 to 60 range is already going up a little bit too quickly. And anything higher than 70, it's just shooting up very, very fast. So you want to avoid the foods that have a very high glycemic index. And I just have to look up for you real quick, what's that glycemic index for agave?
Okay, thank you.
Oh, yeah, you're welcome. Oh, my gosh, yeah.
Anybody else have any questions? Because I got another one. Just I'm full of them. Okay, because see, the thing dealing with fasting.
Okay, I just looked it up. My apologies for the answer. So agave has a glycemic index. So I'll say honey has a glycemic index of 50 to 60. So you just heard how I described that, right? Mm-hmm. Agave has a glycemic index of 15 to 27.
Oh, wow.
Oh, okay.
Yeah. So if you had to pick between one of the two, agave would definitely be better in terms of how quickly your blood sugar will go up. Now, in terms of all those other properties that I mentioned that honey has, agave doesn't have that as much as honey. But if you strictly, you have diabetes, you want to avoid, of course, having your sugar shoot up very quickly. You want to sweeten your tea, sweeten your tea. Agave would be better in that respect than honey.
Okay.
And I find that.
Well, thank you for that question.
I don't use as much agave, it seems, as I do with regular sugars. So that's why I really asked, because I was curious.
Of course. Yeah. And, we also have to think about like how we access these things and really how obviously expensive and what's the palate? What does it taste like? Is it yummy? All those things are also into play here. I'll give you an idea here. So I was just reading. So agave syrup generally in that low glycemic index of 10 to 27, while table sugars index is 60 to 65. And you saw that honey's was a little bit lower, anywhere from 35 to 50. Okay, so if you want to think about it, it's like table sugar is the highest, honey is the next, agave is the lowest.
Okay.
Oh, great. All right, we got another question here. Is rubbing alcohol good, or does it support arthritis?
So rubbing alcohol for arthritis. Great question. I would say that sometimes when our knees are hurting and our ankles are hurting, the actual massage, what are we doing with the rubbing alcohol? We're actually like massaging our knees. I would say the actual massage is really what's can help so much. The other is that rubbing alcohol is very cool. So if our arthritis is causing swelling and heat and warmth there, putting anything cool on our joints can just make it feel better. But it's not like the rubbing alcohol is going into the joint and like penetrating the joint and changing the joint or changing the actual arthritis. It's just that on the surface, it can just feel so nice to have something cool on the skin that's so like hot and warm or swollen. And then the actual massage is so nice. Mm-hmm.
Now let me kind of camel back on that, because
of course.
I don't piggyback on them.
Piggyback.
Being a vegetarian, I ain't piggyback.
Yes.
So now, strychnine worms. You're familiar with strychnine worms, right?
Worms?
Yeah.
Like WORMS?
Yes. The kind that gets in your joints, and they kind of, because I've heard, now I may be wrong, I might have heard wrong, that these kind of worms, they get lodged into your joints, and that's what causes arthritis. And a lot of these worms feed off of alcohol. Now, this is what I heard, and maybe you can clear it up for me.
Well, sometimes we have a term that is actually representing a truth, a real thing. So I would have to do a little research on that to know like the root of that term, like how it started to get used and applied, and like what does it represent? Does it represent a particular condition? Arthritis, the classic arthritis that we know of kind of in general is either osteoarthritis or something called rheumatoid arthritis. And osteoarthritis is when the cartilage between our two bones are starting to wear thinly. And so now it's like bone on bone, rubbing bone on bone. That's called osteoarthritis. And when that bone is rubbing on that bone, that's very, very painful. It could lead to inflammation. And when the inflammation starts building, your joint can start to swell. Sometimes you have to even go into the doctor's office and have a needle put into the joint to drain the fluid out of that knee, because all that inflammation is starting to build up. That's called osteoarthritis. And then there's something called rheumatoid arthritis, where it isn't that the cartilage is wearing out, it's that the body itself is, the immune system is attacking itself. It's attacking that joint and causing inflammation, because the immune system sees the joint as something foreign and it's attacking it. And that's when the inflammation starts to build. So it's very different types of arthritis. One of them, the other classic way of thinking of osteoarthritis is wear and tear arthritis. This is an individual, for example, that has spent a whole lifetime on their feet, standing, working on their feet, and they've had pressure on that joint for so long that it's worn their cartilage down to just very little, down to the bone. And then there's the rheumatoid arthritis, is more connected to inheritance. That's more genetic. That tends to run more in families. That tends to run more as an issue of an immune problem, and an autoimmune problem. In other words, the immune system is attacking itself, itself immune. And that tends to be more running in families. That's more genetic. But I have to look up that term, the worms, and then get back to you on what's the root cause of that. Like, what's the root of that? Because we have so many ways of expressing illness. And they're all correct. And so much of it is culturally based and connected to experience and how our grandmothers and our great grandmothers described our arthritis, right? And how they described it. But it's connected to potentially maybe the worms having to do with rheumatoid arthritis or osteoarthritis. But I'll investigate that for you a little bit more. The history of that term will be fantastic to learn about.
Great. Since we're on the immune system, there's a new strain of what is this mess?
There's everything's a mess.
COVID, yes, thank you. It's a new strain of COVID out here. So what I wanted to ask you is based on COVID. I know it's an immune system kind of virus. So if you build up your immune system, would that not also wouldn't that protect you? Even though they got all these shots and everything they saying that you should take, that I believe just keeping your immune system built up will protect you from these strains of COVID. You know, I don't know if the newest strain that's out now is beyond that, you know, but can you address that for us?
That's a wonderful question, Omari. You're absolutely right. COVID is a virus. And viruses, and it's a respiratory virus similar to the flu virus, like a respiratory virus. So what does it do? Someone might have it, they cough near us, or and we breathe in that air, we breathe in that COVID and that virus, and it goes into our body, and our immune system sees it. Sometimes their immune system doesn't see it right away. And what happens is if it doesn't recognize it right away, if it doesn't try to get rid of it right away with something called antibodies, then the virus will replicate. It'll grow, replicate. We are a host. We are a host for the virus. So it'll replicate. And sometimes the amount of that virus grows so much that it causes the immune system to make lots of inflammation, and that inflammation can build in the lungs, and that's pneumonia. It could build in the brain, and that's neuritis. It can build in the joints, and that's arthritis. It can build in the muscles, and that's myositis. And the immune system, to try to get rid of the virus, it mounts a fever. It increases our temperature because viruses don't like to live in the heat. So as our body's temperature goes up to try to eliminate the virus, that's how it's trying to get rid of it, right? And so, but what happens is that if we get too hot, we can get dehydrated, we can have a seizure. We also ourselves cannot tolerate a temperature that's extraordinarily high, 103, 104. These temperatures are not compatible with our being. And so, but a virus comes in, the immune system responds. Sometimes it responds too slowly, so the virus grows, and before you know it, it causes all these symptoms, and then we're in the hospital. We're intubated, in fact, because we've got pneumonia. We can't breathe with all of that fluid in our lungs, so we need to be intubated. Put a tube down into our trachea in order to get oxygen directly and pressure to keep our lungs open, right? So that's the whole where COVID could go from runny nose and cough and a little headache, muscle aches, joint pains. Now you're starting to recognize why it does all of those things, because that's what it does to the body, all the way to hospitalization and intubation. Now, certainly having an immune system that knows how to recognize COVID right away is so important, because if it recognizes it right away, it can get rid of it right away. And so the vaccines that are out there that are recommended to take are like teachers. They're like little teachers. They're like teachers that go to the cell and say to our cell, hey, if you see this, I want you to behave in this way. I want you to get rid of that when you see it. It's a teacher. But just like any teacher that teaches us something, what happens? Something you learned maybe last year, 2 years ago, 6 months ago, you already don't know it as well as you did 6 months ago. You know it in a different way. You know it maybe vaguely. You know, if you have a really, really good memory, in other words, if your immune system is really very healthy and strong, and it still remembers, it will, when you get exposed to COVID, try to get rid of it right away. But our immune system from person to person varies in that response. It's hard to know who in general can recognize the COVID right away and get rid of it, and the people who can't. What we know is that if you're older, much older, and if you're younger, or if you have a baby, or if you have chronic diseases, already those groups have immune systems that can't recognize the COVID right away. Okay, so those are the groups that right initially when the pandemic started, we were saying these are the individuals that should get the vaccine as soon as possible or soon, before anyone else, because we want their immune systems to be able to recognize the COVID. We know that it may not as well as someone who's younger and doesn't have a chronic disease or illness. Mm-hmm. So the vaccines help us recognize the virus. If I take the vaccine a year ago, years passed since my teacher taught my immune system how to recognize the virus. And so here we are a year later where my immune system may recognize it, but may not as well. If your immune system is not strong or healthy, and this can happen from stress, from not sleeping enough, from not having nutritious foods, from having an enormous amount of stressors at work, all the things that impact our immune system. Yes, even if you took the vaccine, your immune system may not recognize the virus as well. So it's a two-part thing. It's not a one or the other. It's saying, let's have our teacher teach our immune systems how to recognize the COVID, but let's also, as much as possible, keep our immune system as healthy as possible. So when we are exposed, it's going to work properly. And I hope that helps describe that. So the mRNA vaccine is a teacher. That's what it does. It doesn't introduce a new virus into us. That's very different. We have different types of vaccines. We have something called the polio virus, right? Where we take a piece of the polio and we say, here, body, here's the piece of the polio, recognize it. mRNA vaccines, what it does is it teaches the cell itself how to make the antibodies when it sees the virus. It's different. It's not I'm introducing COVID, I'm introducing part of the COVID. No, it's interacting with the cell. So the cell says, when I see that, I know that it's COVID and I'm going to try to get rid of it as soon as possible.
Okay.
I hope that helps explain that a little bit more, because it's an important discussion and it's complex at the same time. But the ways to keep the immune system healthy as much as possible is, getting enough rest, getting enough hydration, having enough as nutritious foods as possible. The foods that are rich, that are less inflammatory, because remember, COVID's already going to make your immune system make a lot of inflammation. So if you're eating foods that lower the inflammation, right? Whole grains, or something called omega-3 fatty acids, which are healthy fish, and you can have fish in different ways that are more affordable. If you're having foods that are colorful, and those colors represent really rich nutrients and vitamins, that's all going to help the immune system stay as healthy as possible, particularly vitamin D, zinc. Those are two very essential vitamin and mineral that what we see is that when people are deficient in vitamin D, they have much more severe cases of COVID. Why is that? Why is that? Because the immune system, because the COVID came in and the immune system was like, they didn't respond, and even in that little bit of time that it doesn't respond, in a day, that virus is going to replicate so much. Right. So you want your immune system to be able to recognize it, respond to it. And vitamin D is one of those vitamins that are very, 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 very important to have at normal levels. So your immune system is more prepared for those kinds of viruses.
Okay, we have another. Oh, go ahead, Vanessa. I'm sorry.
Dr. O, since you're talking about autoimmune diseases, could you tell us why it's almost so hard to get a diagnosis for autoimmune diseases?
That's such a great question. I mean, it really is an extraordinary question. Part of it has to do with when we finally do get to see a physician, when we finally do get to see our healthcare provider to get tested for autoimmune conditions, it may not be during the window when you're having an actual episode of autoimmune disease. So let's say, let's say I have very early rheumatoid arthritis, let's say, or very early lupus, and I'm starting to flare. Let's say I'm starting to get joint aches. My hands are the joints of my hands are hurting. Both of my elbows are hurting, but both my knees are hurting. And I make an appointment to see my doctor to, or healthcare provider to get this investigated. By the time I finally have that appointment, it might be 6 weeks later, it might be 3 months later. And at the time when you go in, you're describing what you felt, but maybe you feel better. Maybe it's like, okay, it wasn't today. They're not as swollen. Today they don't feel that bad today, but my gosh, sometimes they feel so bad. And then they do the testing that day and it comes back okay, it comes back normal. So I think that's one of the really important reasons why it's so hard to diagnose autoimmune disease. Now, we should not be diagnosing any condition based on labs alone. Laboratory tests should be what confirms an illness. It isn't what we need to make the diagnosis. It confirms it. So in other words, with a good history, a good physical exam, someone who is really listening to what you're sharing can put together a list of possibilities where the top number, then the first one is the most likely, right? The most likely. And that condition is what we are testing for. Because we want to do tests that have what's called a high pre-test probability. In other words, what is the likelihood that this test is going to come back positive? If it is very likely that's coming back positive, let's do that test. So let's say on that day of the visit, it was a history of these symptoms so long ago, and now you kind of feel okay. We really need to ask ourselves, what is the probability that the test is going to come back positive? And if it's low, I would say, let's not test that day. That's not the day to test, because then what happens is the person tests, it comes back okay, and then people are given this. Your tests are all normal. You're fine. I've heard people be told like, you're fine. Tests are all normal. And that's not the languaging should be on that day. Your tests were normal. It doesn't mean that you're fine. It doesn't mean that on that day, those tests were normal. And I still am worried that it could be lupus because of your history, your physical exam. So I think we just have to reformat how we're sharing, why we're testing, when we're testing, and what it means when these results come back. Because then folks have this like, oh my gosh, so much frustration and disappointment really, and having these symptoms for so long and not being able to get the clear answers about them. And so oftentimes with my patients, what I'll say is when you're having symptoms, that's when I would say, I've ordered the labs. When you're having symptoms, that's when you should come in and get this tested. And that could be tough though, right? Because if you're in a lot of pain and you're struggling, who wants to get out of their house and like get in a car or a bus even, right? So right. I get that. I totally get that. That's hard. That's a hard thing to do. But I think that's when it's going to be most likely to capture what we're trying to figure out. So I think that's why, I love your question, Vanessa, because I think that's why it is so tough to diagnose autoimmune conditions.
Okay. Yeah. Well, we have another question that says, if a person that has seizures, if their body gets too hot, is that good for that person? I remember you said earlier about your body attacks things, when it heats up or whatever.
Yes, when you're
person that has seizures. Yeah.
It's getting too hot, good if you have seizures. No, if you one way to think about it is if your body temperature goes too high, you're at risk for having a seizure. That's called a febrile seizure. If you already have a history of a diagnosis of epilepsy, uh, that is particularly a person that I would be really concerned about preventing high fevers or any really kind of fever, because if you already have this predisposition or this condition that can make you have a seizure, then you definitely want to prevent a fever. So yeah, on either end, if you already have seizures, prevent that fever, and if you have a high fever, you're at risk for developing a seizure.
Oh, okay. Great. All righty. Anybody else have a question for the doctor? Like I say, I got a
Um,
thousand.
if you have a diagnosis of chronic kidney disease, is that
Mm-hmm.
automatically chronic means exactly what for
Great question.
that?
Yeah, great question. Great question. So, chronic kidney disease would be a person that has had at least a 6-month history where there what's called a creatinine. There's two ways of measuring uh, what's called renal insufficiency. One is something called a BUN. That's one test. The other one is called the creatinine. And that ratio between BUN and creatinine is what gives you something called a GFR. And that's a number, that's a rate at which your kidneys are filtrating. Okay. Normal GFRs are anything above 65. Anything under that, we start to worry, depending on the individual. In diabetes, where the numbers could be a little bit more narrow. So, in general, my apologies. Let me say that again. In general, you want to have a GFR that's 85 or greater, 85% or greater. I was thinking about our heart ejection fraction is 65. So if you have had a GFR that is under that for consistently for at least 6 months, you are now leading into what's called chronic renal insufficiency. And there are different stages. There's a stage 1, stage 2, stage 3, stage 4, and failure. And with renal failure, you need dialysis. And so, depending on when that's caught, there are different ways to approach it. If it's just starting, what we have, first of all, at any stage, we have to start thinking about what may have caused this. What may have been the reason for this insufficiency? A lot of times, a very, very, very common reason would be dehydration. Another common reason may be taking ibuprofen, something called non-steroidal anti-inflammatories, or ibuprofen. An infection, so an infection that's leading to a high fever that could lead to dehydration, could lead to lower blood flow to the kidney, and you suddenly now your kidneys are not filtrating your blood as well as it should, and you're becoming what's called renal. You have a lower kidney function. Okay, is the way to think about it. And if it persists beyond 6 months, the testing for it, it's chronic. And so many times what I've just described are reasons for acute renal problems, right? Dehydration, getting sick, medicine. Reasons for chronic renal problems or chronic renal lower function. I like to say it in different ways. Insufficiency, what does insufficiency mean? Lower function of the kidney. So other chronic reasons for lowering the function of the kidney would be diabetes, hypertension, okay? Maybe being on a medication chronically, like have patients that have been on ibuprofen for many, many years because of pain, maybe arthritis pain, and that was the reason why they now have chronic renal lower function, right, or insufficiency. And so depending on the stage, always you want to know what's the reason, what's the chronic reason, and what's the acute reason. Because sometimes people have diabetes and that's the reason why they have lower functioning kidney. But let's say that weekend they got really sick. They developed COVID and they had a high fever and they were dehydrated, and suddenly now their kidney function is even worse, right? And so I would say that chronic meaning a time. It's a time frame. That's why we think about chronic. The definition of chronic has to do with how long you've had lower function of your kidney.
Okay, so it's not that chronic means terrible. It just means
No.
that.
Okay. Yeah, it's not chronic. Doesn't automatically assume severity.
Okay.
Exactly.
I mean, that's what I thought.
Great,
yeah, I
great
thought
question.
chronic means, yeah. Okay,
Great
thank
question.
you.
Yeah, chronic doesn't automatically mean this is the worst. Chronic means it's been around for a long time, at least 6 months.
Okay.
And then it's the staging of it. Yeah.
Okay.
Okay, thank you.
Of course.
We got about 5 minutes left. Let me see. I don't see any other questions out in our audience. Is there any other questions that anybody on the? Go ahead, Kim.
You mentioned several times, Doctor, about hydration.
Yes.
So, and I've seen on the news studies stating that it's not necessary to drink 8 glasses of water. So, what would you recommend the amount of fluid someone should take to make sure they're at the level they need to be of hydration?
I love that question. Fantastic question, because we are all chronically dehydrated.
Yes.
and that's why we tend to eat a lot, because it's actually not hunger, it's thirst. We're actually really thirsty. And I often say to myself, okay, how thirsty am I? And am I confusing that with hunger? I'm a real plain spoken person, and I think about the logic of it. If you go to the bathroom and you pee and you look in the toilet and the water is yellow, you already know you need more water. You need more hydration. Your urine is concentrated. Why do kidneys concentrate urine? Because we're not taking in enough water. And so the kidneys have to concentrate the urine to conserve the water, right? So if you go to the bathroom and you pee and you look in the toilet and it's yellow, you can say to yourself, my kidneys are trying to conserve water. and that is a direct indication that I am not drinking enough water. So I would say drink enough that when you go and you pee, you can't even tell, it's clear, like the water should be. That's one quick way to think about it. The other is if your skin really starts to feel on the dry side or your lips are feeling dry, that's an automatic indication that you need to drink more water. And you're right, the intake of water varies from person to person depending on the underlying conditions they have, how much they sweat, how much they're exercising, their body temperature. I promise you, I probably need more water right now because I'm going through perimenopause and I have hot flashes all night. I'm just sweating all night. So I should probably have a lot more water this year than I ever have had in my life. But so I think, if you go into a state where you're sweating more and you're losing more water, you certainly know you have to drink more than you have before. I would say foundationally, that kind of data that says you don't need to drink 8 glasses of water a day any longer, I'd be careful to think about it in this generalizable way. I would think more like, okay, what do I need? Me, Kim, what do I need based on my exercise, my activity, my conditions, how I feel? Is my skin hydrated? Or is my urine clear? And you're going to get, as you live and as you're drinking, to that point where you say, for me, it's actually 10 glasses,
Oh, wow.
Right? Because, for me, actually, I'm going through this new state in my body that I need more water, maybe it used to be 6 before. So I try to think about it that way. And for the most part, you if you're not, if you're drinking so much water that you're now starting to dilute your system, and now you're going into problems with your sodium, that of course you don't want to do that, and you want to prevent that. But that'll happen. That the ways that you will know that is if you start developing like fatigue or headaches, or you're urinating a lot, and to try to get rid of that extra water that you're consuming that you shouldn't, because your kidneys are always going to try to get rid of it too, whatever excess that you have. So it's not like it goes in you and it stays in you. The only reason it would stay and dilute your system is if your kidneys are not functioning, or not functioning properly. So with normal functioning kidneys, just temper it according to you, to your activity, to how you feel. And it's probably going to end up being like 6 to 8 glasses a day, honestly.
Okay. Thanks.
Yeah. Of course.
All right. We got time for one more question. We're really out of time, but I know you wanted to ask this question, Vanessa, about
I wanted Dr. O to talk about menopause, and
menopause.
she just touched on perimenopause, so both hand in hand.
Oh, menopause. Oh, perimenopause. Oh my goodness. I mean, we probably need like 5 hours.
Right, we need a whole session on that.
We need 5 hours.
Well, you call Vanessa. Call Vanessa.
Right. I mean, I think in general, what is it? It's a time of life where we're no longer producing as much estrogen as we used to. And as our estrogen levels start to fall, then our blood vessels respond in this really very erratic way, right? They either like get very open, and that's where we have the hot flash and the sweat, or they get really tiny. It's called constriction. They get really tiny, and we get cold and clammy. And it's just back and forth throughout the day, depending on activity, stress, caffeine, sugar, so many things can trigger a hot flash. And in general, sometimes it's just like almost out of our control. It just happens randomly. And I would say that there is treatment. There is so much that one can do, from either a lifestyle medicine perspective, all the way to hormone replacement, to help with these symptoms. We do not have to suffer. We do not have to suffer in silence. We don't have to just tough it out. If it's affecting our sleep, our mood, our activities of living, our relationships, if we're so irritable and so in the upsetness because we haven't rested for days, and we can take it out on our family members. We can get short and with our family members, because we were just kind of like at the at the tippy top, like don't talk to me because I'm
the height of festivity.
I'm exhausted, and no more conversation, please. So if it's affecting our quality of our lives in this way, then yeah, please, there is help. There is so much that we can do, from food as medicine, exercise, stress management, supportive sleep, supportive rest, hormone replacement. We used to think hormone replacement was all very, very, and in some forms, hormone replacement taken orally at a very high dose of estrogen can certainly increase our risk. But now we know more and more that actually now it's very heart protective to replace our estrogen. And it doesn't cause the breast cancer risk that we thought. And that's because of that if it's taken transdermally or through the skin, through a patch versus orally, that changes the risk dramatically for those things. So we don't have to suffer in silence. We can absolutely get some support and get some help for our symptoms. So we can be kind to everyone around us, including ourselves.
That is so great. Thank you, Sonia. Dr. Oyola, we thank you.
You're welcome.
Before you go, can you tell, because now I tried to sign up for you to be my doctor. And you're not in network with my insurance.
Oh, come on.
They wouldn't let me sign up for you to be my doctors, and I'm highly disappointed that I couldn't do that. But can you give people? We know you work at the University of Chicago.
I do. I work at a clinic right at 55th and Cottage Grove Avenue. And if you want to make an appointment, all you have to do is call over to the clinic. It's 1-888-824-0200. And you can ask, and that's 1-888-824-0200. And you can ask to, make an appointment with me. And I'm there on Tuesdays all day doing integrative medicine consults. And so that would be, if you want to refer yourself to get a consult, that it would be my pleasure. That's 1 hour where we get to talk about mind, body, spirit, and all the ways to combine conventional and complementary medicine. And on Wednesdays, it's my primary care day, or even urgent, or even walk-in days. Walk-in same day appointments. If you need anything, that's a Wednesday morning that I'm there. But it would be my honor and my pleasure to be of service in any way and get to sit and chat about all these things.
Fantastic. All right. Thank you again for being on. I got 1,000 more questions, but
Me too.
Maybe in another a month or so, because I know you're extremely busy. I know you just came back from
from Panama. Mm-hmm.
Panama, right? Doing a medical thing, helping how would I call it? Less fortunate young women with PAPs, things of that nature. So I know you travel a lot. But when we can get you back on, we'll get you back on, and then we can get some more answers to a lot of medical questions. Of
course, it would be my pleasure. I love spending time with you all. Thank you for all your brilliant questions and your inquisitiveness and your kindness and your knowledge. Your questions really make me learn more. And so I really appreciate you very much.
Fantastic. All right, until next week, you guys. We'll be here next week. Make sure you tell a friend, tell your mother-in-law, tell everybody. Until next week, we out of here.
Bye.
Thanks for supporting our podcast. We look forward to see you next Thursday at 8 p.m. We also ask that you subscribe to our YouTube channel. The more subscribers we have, the more YouTube will push our podcast to more viewers. But until then, subscribe also for a peaceful mind. Your activity will reflect that peace.